What's up, guys? John here. Titan Talk Tuesday. We're coming from a different location today. So I'm actually coming to you from the inner lobby of Titan Medical Center. So this is where all our patients come in. They get to sit. They get a nice water. They basically get to sit down and do everything. And they get checked in. So today's episode is going to be awesome. So we got a lot of stuff to talk about today. And let me just set up this tripod real quick. At that point, I want to make sure that we are talking to everybody. So just excuse me real quick on Instagram. You guys upside down. All right. Let me just scoot you guys in. Almost there, guys. Bear with me. Bear with me. Awesome. Whoop. Sorry, guys. All right. So what's up? How are you guys all doing? Thank you guys for joining me for Titan Talk Tuesday. I really appreciate it. We're talking about a lot of different things today. So we've got a lot of different events that are coming up for Titan. We've got a lot of different athletes that are coming on for Titan. We've got just so much stuff to cover. It's awesome. I'm truly blessed and grateful for all the opportunity that has come for Titan Medical Center and all the different things that we're doing out there. I mean, we are just expanding out into different things and helping a lot of different people that we've never even thought we'd be able to help. So it's really, really cool. If you guys haven't been following us, I actually had some of my athletes come in from South Africa. I had IFFB Pro Lee Chaldecott and her boyfriend Kevin Keyrouz in town for a couple weeks. They joined us for the Europa Expo. If you don't know what that is, it's like a fitness expo, an apparel expo. They got to visit us for that. They got to really hang out with us. We did some great training videos. We talked about the differences of there to here. And just a whole bunch of different things, that you get to experience maybe here that you don't get to experience there. And it was just really cool to see some of the inside. What's up, guys? I hope you guys are all doing good. So that was one thing. On this episode, we're going to cover a lot of different things as far as the therapy of the week, Hercules Potion. So if you guys don't know about Hercules Potion or you've heard it maybe a couple times, I'll explain it again. I'll explain what it does and how you can go about getting prescribed this from Titan Medical Center. Also, I'll talk to you guys about blood testing. We're nationwide in blood testing. We service you nationwide in our vitamin amino acid injectables and a lot of different therapies we offer, okay? So it's very simple to become a patient with Titan Medical Center and very, very simple to get on our therapies, some of them anyway. I also want to talk to you about one of the things that affects me, and I guess it affects a lot of different people out there, and as I'm going through right now. So, should I train when I'm sick? And then what should I look for, or when should I not train? So at that point, I'm going to give you guys some insight of, what you should do. You should always check with a medical professional. I'll just put that out there first. But what you should do, and with some basic guidelines to if you do have a cold, a common cold, flu, or maybe an infection. And at that point, maybe you should train, maybe you shouldn't, and some of the other remedies that will possibly help you guys out. So I'll go over that and kind of my secrets because I usually never get sick. I'm usually on glutathione, and that's a super antioxidant most of the time, and I usually rarely ever get sick. So now, as you guys can hear, I do got some congestion. That's fine. I'm finally getting over it, and it's breaking up in my chest and stuff like that. So it's starting to come out. Finally, thank goodness, thank God. But all right, so let's talk about it. Let's talk about the therapy of the week first. Hercules Potion. So what is Hercules Potion? Hercules Potion, in our YouTube video, I think we've got over 1.3 million views on it. It's crazy. So what it is, it's a vitamin amino acid injectable therapy that we produce here for Titan Medical Center patients. Now, we don't produce it ourselves. These are doctor prescribed and made in a U.S. licensed compounding pharmacy. So at that point, we're not making these niche vitamin amino acid blends here at Titan Medical Center. We don't ship them out from here. They come from the U.S. licensed pharmacy, and they ship them directly from there to you guys. So, what is it? Hercules Potion is made up of glutamine, arginine, ornithine, lysine, L-citrulline, proline, taurine, NAC, and L-carnitine. It also has lysine in there. So at that point, what's it going to do for you? For glutamine, it's going to help for recovery. So if you're really hitting the gym, you need the extra recovery. Glutamine is there for muscle recovery. It's an amino acid that's for recovery, okay? You're also going to have arginine and L-citrulline. They're precursors to nitric oxide. They're going to vasodilate, and at that point, it's going to show more vascularity. It's going to help blood get through there, through the veins. It's going to make you look more pumped. It's going to hold that pump for a longer period of time too as well. So you're going to get a great effect, let's say per pre-workout, but it's not going to have any stimulants. There's nothing in there like that. You're going to get the good recovery effect, the vasodilation, the muscle pump. It also has lysine in there to boost the immune system, because when you're working out, and a lot of you people know that it will actually put strain on the immune system. If you're working out really hard, some of these competitors that go through prep, they get sick a lot. It's because they're breaking down their immune system even more, and then they have to fight off all these crud and all these germs that they're possibly catching in the gym that they're at, because most people don't have their own personal gym, okay? They're either going to a really, really crowded gym, they're going to an older gym that might not be as clean, right, or not be, up to date on their cleaning. So you're gonna have infect it, or there's somebody that's on the bench before you that's sick. You don't wipe it off, they don't wipe it off, and you catch that sickness that way. There's a lot of different ways, touching hand weights, dumbbells. I've seen a lot of different things, and when you start thinking about these germs and how long they can even stay around on some of these things, it's usually not for that too long. But if a guy puts down a weight and you pick it up immediately, you have a chance of catching those germs. So just make sure you're always, godliness and cleanliness. Cleanliness is next to godliness. So at that point, you want to make sure you're as clean as possible. You want to make sure that you're doing as much of the cleanly techniques as far as washing your hands as much as possible, okay? Hand sanitizer when you're in the gym, sanitizing off the benches and stuff like that. So when should you work out and when should you not work out? So the rule of thumb usually is above the neck is when you can usually still work out. You still have like a runny nose, you're sneezing, you might have a little congestion up in the nasal passage, but it's nothing that's below the neck. If you're having like a heavy chest per se, or fever, you really don't want to go work out in those days. Having a fever and going to work out can actually make things a lot worse, and it can increase that fever and stuff like that. So you don't want that. If you're having body aches, muscle aches, anything like that, that could be an issue too. So look for those symptoms. Also, when you're running a fever and you're going to work out and stuff like that, you could be causing yourself to go in dehydration, severe dehydration. And this does happen quite a bit to those more hard-headed athletes that just says, I don't care how I feel, I'm going to train, and that just is what it is. So at that point, they don't care. They don't care if they're sick, not sick, broken leg. Well, guys, there's ways to be smarter and train smarter. And at that point, if your endurance isn't there, if you're feeling weak, and we also got to remember that training is a catabolic effect. And if you're not eating, so you're listen, we know when we get sick sometimes, our appetite just goes away. And that is due to usually a fever sometimes too as well. So at that point, if you're working out, stuff like that, you could be burning through some of that muscle per se. Now, taking branched chain amino acids is good for anti-catabolic effect as far as the essential amino acids too, and getting them all. Now, not getting them through your food because you don't have an appetite, you need to get them some other way, shape, or form. That's where the injectable vitamins and the super antioxidants like glutathione or injectable vitamin C or NADH, a lot of these different things, injectable branched chain amino acids, which is in the Titan Complete, will definitely help you, and you won't have to eat it. You can actually inject it even when you're sick and still get the benefits of these things, which is a benefit to you guys, because if you're like me, you're still trying to get some of these foods down your throat, and it's tough, man. They don't taste the same. Your mouth is dry. You feel like garbage. And I've experienced this the last 2 days, and thank goodness for my injectable therapies. Because, at some point, I know, like, when I took the glutathione, like, right afterwards, I definitely felt a little bit better. And it definitely helps for, like, people with allergies and stuff like that. So it helped open me up a little bit in my nasal passage as far as breathing. Now, when you have a little bit of congestion, let's say in the nasal passage, they say, like, running and opening up those airways can help break up that congestion. But you want to be safe. And like I said, you always want to check with a medical provider if you're really questioning it. Now, if you're spitting up phlegm and stuff like that, it's getting color, you're having tightness in the chest, you're feeling heavy in there, you probably want to go see a physician or a doctor or walk in a walk-in clinic. Give yourself a few days rest, and then you should be better. You should not be as weak. You should be able to come back stronger. Now, the congestion may last for a little bit longer. You're getting out of that crap out of your system, but you're feeling better and better day after day. And that's when you know that you're starting to get better. If you're feeling worse, time goes on, then something is going on. It could be an infection, from a viral to an infection. It happens a lot. Or you catch two types of colds, a viral and an infection, And at that point, you might need to be treated for one or the other. Viral, obviously, you can't treat with antibiotics. You have to run its course, all right? But infections, you usually want to treat with antibiotics, and the medical physician can probably prescribe those to you. And that's through a lot of different ways. Like telemedicine is great. I know the hospitals here, like Tampa General, they do a great online system. There's concierge medical clinics like ourselves or other places that do it. So there's ways for you to find this, guys, even if you're on your lunch break and stuff like that. And don't be selfish. And what I mean by that is, and everybody has to do what they have to do. But that doesn't mean going around getting everybody else sick. If you know you're sick, you're going to go around and purposely do that to either coworkers, your family, people at the gym. That's not fair, and that's not very cool. Now, if you don't know you're sick and you have an infection and stuff like that, and that is what it is. But if you purposely know that you have strep throat or you have something like that is contagious and highly contagious, and you're not treating it properly, and you go do these things, that's something that's not very, very cool, and I look down upon that. Even here in the office, if I'm sick, or one of the other staff members is sick, and they're here, per se, and most of the time I tell them now go home because it's not worth getting everybody else sick because productivity is low, everybody feels like garbage, but we won't wear masks. We won't wear masks in here to make sure that we don't contaminate or we're not getting other people sick. That's just the proper thing to do for people, right? That's the right thing to do. So just remember that. And now, a lot of people get sick from their kids bringing them home germs because kids are going to school sick and they're giving it to your kid, and your kid's coming home and getting you sick, and you're getting your husband sick or significant other sick, and then you're going to your job and getting them sick. So the best way to do that is to teach your kids young. Teach them to wash their hands properly. Because there's a lot of kids that just go there and put their hands in water and scrub them together. Guys, you're not moving anything but germs back and forth, then you're putting them everywhere else. Teaching kids how to cough properly. I've seen kids and they're out in public, or even adults at that point, and they don't even cover their mouth in any way, shape, or form. Like this. They are just blatantly coughing in people's faces or out in front of people, which is not cool either. And if you have proper etiquette, you'd be that person to either cover your mouth or do the right thing, right? So just remember that, okay? Now, we've got tons of events coming on. I want to get into some of those events because we've got some really, really cool events coming. The next big event, obviously today we're at 3 different crunches, and that's local. We have our great Titanettes out there. They're representing. Go check in with them. Get some free Titan gear possibly. It's time to be on our newsletter so you're in tune to everything that's going on with Titan Medical Center. Just ask them some information about Titan, Or you can even call or text us about some of this information. Once you talk to them, you can sign up to be on our newsletter with them too as well. So it's just awesome. So please go up, be interactive with our Titanettes out there. We'd love to interact with our patients or just people that want to find out about what Titan Medical Center is all about. Next big event, though, is June 15th. June 15th, the Deke Warner Classic will be happening in Orlando, Florida. June 15th, mark in your calendars. We're going to have the real Mr. Olympia guest posing. Can you believe that? Sean Roden, the heavyweight Mr. Olympia, the real Mr. O, will be in the house guest posing. Titan Medical Center is going to do a seminar about health, hormones, weight loss. We're going to do a Q&A. I'm going to have some of my athletes down there too. I know Deke's going to do a posing seminar. So it's just going to be a fun-filled event in Orlando. I'm bringing part of the Titan family with me. We're going to represent. We're going to have tons of Titan gear out there. We're going to be in the house. So please come out and join us for that. It's going to be awesome. The next month after that, we're heading down for PCA in July. I think it's the 7th. We'll be in Miami. That's going to be a huge show. I've got some of my Titans representing and going to be in that show down there. It's just going to be a new place for you guys to debut yourselves as athletes. If you're not a pro and you're an amateur and you're looking to get your feet wet or you're looking to become a PCA pro, you can definitely sign up, be a part of that, see what it's all about, and then make your own decisions about what you want to do in the future, guys. What it's all about, right? So that's really, really cool. We just signed up to be the title sponsor too as well as for the Daytona Classic. I'm very, very happy. Michael has been trying to get us on to do that for a couple years. We haven't had the manpower until this year. So you know what? When I talked to him at Europe, I said, Mike, we are going to be down. We want to be the title sponsor. We're going to be exclusive to you at that point. we're going to be representing. So Titan Medical Center is going to be down at Daytona Beach for the first time, right? Representing Daytona Classic. Very excited to be a part of such a great production and great people. Michael, they are great people, him and his wife. They've done a lot of great things, and I'm very, very happy for Titan to be a part of it this year. Very excited, very excited. A lot of new events for Titan this year that we've never really done before. The bodybuilding events we're a part of, the fitness expos we're a part of, festivals of speeds coming up, we'll be a part of that one in Orlando. We were part of that one in St. Petersburg. That was a really, really cool event. We were part of some charity events. We've got some other Titan challenges coming, so stay tuned to that. We're bringing on brand ambassadors. We have Titan athletes all around the country. I do look for some sponsored athletes or brand ambassadors. Now, people come at me all the time. Every day, I get inquiries about sponsorship, being brand ambassador, wanting to represent Titan Medical Center. We've been in business for almost 7 years now. I'm very, very picky who we bring on. I've been through it all with sponsored athletes, and there's some good, some bad, some ugly, okay? But, I'll never say anything bad about any of them. They've all taught me something, one way or another. So I appreciate you guys for that. But different things that come about, because Cherise did a soapbox on this, and she did address sponsored athletes and some of the ways that some people have came at her, and she kind of vented out a little bit. Now, listen, that's not to go to say for our sponsored athletes right now. They are awesome. Our tight nets are very, very awesome. They all represent. As long as they're doing what they're supposed to, you're fine. Now, if that applies to you and you're not doing what you're supposed to, I guess it applies to you and you can take it as such. So take it as a lesson and do what you're supposed to do. All right? Well, most of you guys, I would say, is doing an awesome job. Phenomenal. And the past people, listen, if you're going to go represent a company, go represent the company. It's not all about you. It's all about benefiting both of you guys, right? And the athletes should be more in tune to what the company is about and how they can really help the company, because they're coming there for sponsorship. The company doesn't owe them nothing. The business doesn't owe them nothing. The medical practice doesn't owe you nothing, right? And that's vice versa. So at that point, if you're coming there and you want to be a part of the team family or Titan family, know something about us. Know what we do. Be a part of what we do. Have I seen you at events? Have you came up and talked to me? This is for sure. I'm definitely not going to sponsor you or be a brand ambassador if I have not talked to you. If you call up and you say, I want a sponsorship, and you have no idea what we're about, what our mission is here at Titan Medical Center, because it's twisted. I've definitely heard it from a couple people and what they think our mission here is at Titan Medical Center. And it's way off course. So at that point, I want people to know what we stand for, what we're about, and what made Titan Titan, okay? And how you can be of value to Titan, right? Because I know Titan Medical Center can be of value to you. In one way, shape, or form, we can be of value to you. Whether it's sponsoring you in your competition, whether it's getting your health straight, right? We can be of value. So I know we're not a supplement company. I hate the word even supplement. We do medically prescribed therapies. Now, it is a form of supplementation, I guess, in some aspects, right? But what we do is medically prescribed. So you are seeing a doctor. They are coming from a U.S. licensed pharmacy. These medications aren't free. The doctor's time, guys, is not free. Doctors are expensive. And I employ doctors and nurse practitioners full time to see every patient, to make sure that they're getting the quality service and patient care that they deserve. And that also goes for my sponsored athletes or tight nets or brand ambassadors. You guys are the same way, and you guys are family to me, and I treat you as such. And I would appreciate the exact same thing in reciprocation. And like I said, this is not going for anybody current or anything like that. I wanted to put that out there. I love all you guys, and I want to make sure that we're all on the same page. And for people that want to become sponsored athletes with Titan Medical Center or Titan Nets in the future, guys, you get in what you put out, right? You reciprocate. You do these things. These are what makes good relationships. And I'm not talking about just Titan. I'm talking about in every relationship you do. Don't make it one-sided. Always reciprocate. Always make that person feel the way that you want to feel. So if you want to feel good, make that person feel good. And I guarantee you, just like me, I'll do it 200% times more back to reciprocate that nice deed or what you've done for me. I promise you. But if it's always one-sided, and that's in any relationship, that's in a marriage, that's in work, that's in a sponsorship, that's in anything, take it as such, right? Apply it. Would you like that to be done to you, or would you think that's right? Now listen, guys, everybody makes mistakes. Own up to your mistakes. Do the right thing. If you've done something wrong, don't talk about it. Be about it and make the action. That's the best thing I can say. Nobody is perfect. I'm not perfect. Sharice isn't perfect. Nobody in Titan Medical Center is perfect. And I guarantee you're not perfect, okay? As much as we like to think that we are, we're not. Now, the goal is to be as best as we can, right? And to get to perfection, but nobody's going to get to perfection, okay? We're not God, and God's not even perfect. So at that point, take it as such. I love you guys for that, all right? Another therapy coming up, thymosin alpha-1. You guys have heard me talk about it a couple times. I've really been taking it a lot lately, especially with this. TA1, thymosin alpha-1, is an immune system boosting modulator. At that point, it's going to help boost the immune system. Now, there are some other things that will help boost the immune system along with that, like super antioxidants like glutathione or injectable vitamin C. You can do that. Now, when you inject the vitamin C, if you can't do that therapy with us, it can sting a little bit. So just be forewarned. You can mix it with a B12 and stuff like that, and it won't be as bad. So that is a heads up for you guys. Now, summer is coming. Tomorrow starts May, right? So June is right around the corner. Now, it doesn't matter usually where you're at in the United States. June, July, August, it's summer for everybody here. So at that point, you're going to go to the pool, you're going to go to the beach. You might want to go outside and get a tan. So you want to probably look your best, when you're going to go outside, right? If you're going to go out in front of the pool, in front of people. I see it a lot because we live down here in Florida, and it's a very, very vain state. And what I mean by that is, it's usually sunny or warm most of the time, and people usually take off their shirts and want to look their best all the time. So at that point, when you're doing that stuff, you want to look your best. So get a jump start on it if you haven't already. We can help you out with weight loss programs, getting your hormones back on track. If you have questions or you're plateaued or you don't know what's going on, we can help you. At that point, you might want a blood test, and we do a full panel, cheaper than anybody. And I hate to use that word, but it really is. It's least expensive, and it's cheaper than anybody in the United States. Apples to apples testing. That means the testing you get from us compared to testing you get from anybody else, I'm guaranteeing it to you. I will beat their price, and you will get better testing as far as that goes. And I use Quest, I use LabCorp, I use multitude of different labs. So at that point, we can service you anywhere in the United States as far as that goes. So I want to make sure we take care of all you guys. All right, so I'm going to read some of these. So Kevin, my man, I love you, dude. So Kevin and them are heading back to South Africa. If you guys don't know who Kevin and Lee are, please check my videos. They're my South African athletes that were in town here, and I enjoyed their company tremendously, man. And they taught me a lot. I mean, just being here, it was awesome. Matthew Wolf. All right, so glutathione helps chase colds away. Hercules gives me the extra push for the day. Absolutely. So Matthew knows. He's on the road a lot, and he travels. So it's really, really cool. I keep up with a lot of patients as far as much as I can on social media. And I like to see what they're going through, what they're experiencing, or what their job entails. Because some of these guys got stressful jobs. I know Matthew travels a lot and stuff like that. So he's always on the road. He's always in airports. He's always dealing with, a lot of different people. So at that point, even internationally, and at that point, he's probably having to build his immune system. He's on planes. All right, Jason Lynn. Always say, be selfish and keep that, keep it to yourself. Absolutely, man. So it's definitely the way to be. So don't be selfish in anything you do. I promise reciprocation and being that bigger person. And it's about being that bigger person. Sometimes people get the best of us, or at that point, you might feel like you've been taken advantage of. Don't get sour. Don't shrivel up as far as that. Don't get the mean grumpiness, and this is how everybody's gonna be like that to you. Kill them with kindness. Make people smile. It will help you. I promise. It makes you feel better and will make other people feel better. A lot of people I see today are very unhappy, and that's for a whole bunch of different reasons. That may be because of their job. That may be because of the way they feel, right? Their hormones might be down. They might be depressed. They might not have any energy. This is something that hormones could change. And when you optimize your hormones or get these things correct, that could change your demeanor. That could change the way you feel about things, your motivation. So that could be a thing that changes happiness per se, right? But some people, that might not do it. So these people in some way, shape, or form are angry about something or down or upset, or maybe they just look mean or upset. I get it all the time, especially when I have a beard. People think that, what's the matter? Are you upset or something? No, I guess that's just my resting face. And Teresa would call it some other, she would call it her resting bee face, right? And at that point, it is what it is. But sometimes it just takes a smile from a stranger to make that person smile, or a joke for that person's day to go from a bad day to a good day. So just be aware of that, man. I mean, if more people were like that, I think our world would be in a better place. And I really go back to the 1950s. 1950s, your neighbor was your neighbor, and people treated people like family in the block. Where now, your neighbor is not your neighbor, and you better watch out who's across the street from you. You know, at that point, you got to watch out for these different things. People back then didn't lock their doors. They were more trusting. Now, you can't be more trusting. You have to be cautious before trusting, because you don't know what that person is going to do or what's going to happen to you. We live in a really messed up world. I hate it. My son's got to grow up in this world, and from the way that I grew up to comparing to where he grew up is a whole different world, a whole different ballgame in a lot of different aspects. The way we think, the way we talk, the way that things get brought up. People can't talk about things these days, or they get thrown in their face, about different things. You know, sexist, racist. That person doesn't like me. It's just a lot of different bad things out there that I think that some of these things can change with people's demeanor or the way they treat other people. That's another thing that I want to bring up. This generation and age. I was watching a show last night. It was on the news, and it was on like a political type platform news. And I wasn't watching it, but I was just clicking through the channels. But one thing he did say, they had a doctor on there, and I stopped the channel. And I started listening to what they were talking about. And they were talking about the decline, right, of males in America that have low testosterone, right, and are not fertile or unfertile. And this is a higher number than any percentage we've ever had before in the United States. That is something concerning, and that's generation-based too as well. So we know that the number in testosterone levels has decreased significantly, okay, from even the baby boomers generation to this generation now, even through my generation. So at that point, when you do blood tests on patients and they're 25, 26, 30 years old, never touch any anabolic testosterone, any anabolic steroids, nothing like that, totally natural, and comes back clinically deficient for testosterone. Guys, that's a problem. Now, what that doctor was contributing to was the chemicals that we are either putting on our body or putting in our mouth, per se, in our environment. And we got to look at our food sources now. Now what they were bringing up is pesticides. Now, you've seen all the lawsuits about Roundup, right? So most of these pesticides can be affecting our hormones and causing hormone imbalance. Now, guys, this is starting to be really, really crazy. I even seen a lawyer commercial for, that stuff that colors your hair to get it blacker. Well, there's this one version of it that's supposed to have a chemical in it that's 30 times the other amount that's in these other the exact same brand. I'll come up with it next week, and I'll tell you exactly what brand it was, so you guys can watch out for it. But these lawyers, now I know attorneys can go after everybody for anything, but to see them go after something like that is really, really crazy. And to have these doctors on there talking about some of these things like pesticides and stuff like that we're intaking, and to really be affected on hormones like that is doing a disservice to us. So watch your food sources, guys. That's one big thing. I never really thought about it until I really got into my 30s, and I really started Titan Medical Center to really look at my food source. And I always thought, I'll just eat pretty clean, right? And that's steak, chicken, and some of us are on our budget. So sometimes you were going to Walmart, Winn-Dixie, whatever, and you were getting whatever was there. It was the cheapest. You knew it was steak. You knew it was lean meat. You knew it was chicken. Now, it might not have been organic, right? So you're talking about antibiotics. You're talking about these different things you could be intaking there, even on your vegetables and stuff like that. I've seen this other thing about the wax they put on apples. And you know why they put the wax on apples, right? To make it shine, make it really presentable, the marketing aspect of it, and then washing that wax off, and how long it took to wash that wax off. So it's really crazy, because when we're growing up, and I'm sure you teach your kids this too, or you do it yourself, usually wash off your fruit that you get, right? And you like wipe it off, with a paper towel or whatever it is. Even that was still leaving some of these things on there because it wasn't properly washed. And to go to that degree, to really having to scrub down your vegetables before you intake them, is kind of crazy when you think about it. And is it really viable for you to do every day? I don't think so. So at that point, you just got to really watch what you're doing, I guess. For us at Titan Medical Center, we have a lot of different therapies that we're going to start bringing out to you guys that are more natural, like follicle acid, injectables. There's a lot of different other vitamin amino acid injectables that we're going to be using for you guys or bringing out as options for our patients. So stay tuned to that. I promise you, you're going to like some of the things we're bringing. I think that's really about it, guys. If you guys have any questions, concerns, please, you guys can always call or text 727-389-3220. We service nationwide with blood work, so we can do a la carte testing. That means a single test, like a free and total testosterone or an estradiol or just one single test. Or we can do the multiple full panels. And for males, it's $150, and that's discounted down from $200. For females, it's going to be $225, and that's discounted from $300. Now, that has more tests in it for you females, and that's why it's a little bit more expensive. Now, the common question before I get off here is, does my insurance cover this? Now, we don't take any insurance at Titan Medical Center. And insurance may cover some of the blood tests if you go to a primary care. They're going to have to produce diagnosis codes for it to be covered in the insurance. Sometimes insurance companies still kick it back. And at that point, you could be getting a large bill, a very hefty bill, $1,000 to $2,000 bill, because the doctor's office is not responsible for it. And once you sign off on the paperwork through them, they put that responsibility back on you. And if you have to pay a high deductible, you may be paying that out of your pocket anyway. And to have those diagnosis codes be on your permanent record, it's like a pre-existing condition if they start treating you for it. At that point, that's how the insurance companies look at it. So don't be fooled by people saying that, you know, blood work is covered by insurance. Now, they do cover some of the tests. I won't say they don't. But usually some of those tests are only covered one time per year too as well. And you're going to want to monitor some of these things multiple times a year. So just be in tuned and enlightened to some of the things I'm talking about here. Don't let the shade cover your eyes. And know what tests you're getting. Make sure that you're getting a full in-depth panel. That word is thrown around a lot by a lot of medical practice and practitioners. A full in-depth panel means all the tests in there, not just 3 tests, and that's our full in-depth panel here. Line up to what you're going to do. Make sure you get all the tests done, and make sure it's the best possible price for you guys and the best possible option. If you do blood work through us, we can also help you with medical assistance as far as hormone replacement therapy, our vitamin amino acid injectable therapies, libido enhancers, hair health capsules, hair products as far as help keeping your hair, fat burning cream, a lot of different things. Our ECA Stack Plus capsules, which is great. And we're going to have these summer packages rolling out for you guys here in the next couple of weeks too. So stay tuned to that, which is going to incorporate a couple different options for you guys to use topical, injectable, and oral therapies all at once and give you the best bang for your buck as far as our summer packages go for you guys. So I think I've talked enough. I think I've rambled on enough for you guys. Make sure you guys are checking us out on Facebook, Instagram, right? If you guys are on YouTube, press subscribe. Make sure you guys go to YouTube. We have tons of videos on there. Sharice's soapboxes are on there. We've loaded on there. We've got our full-length videos on there, like our blood work videos we just did with Lee and Kevin of us going to the lab, kind of what entailed, us talking about some of the labs we were doing and some of the possible negative side effects. Guys, if you're on hormone replacement therapy with your doctor, your current medical provider, like a primary care physician, this is for you guys. Make sure that you're getting your estrogen checked, your estradiol, your E2, and make sure that's not over range. And make sure they're going to check it for you and they're going to properly treat you for it. That, and you're probably going to want HCG along with it, so you don't get no atrophy in the testicles, you don't get low semen production, you don't get no tightness of the testicles, and HRT is enhanced a little bit better for you as far as libido-wise and a couple of different aspects. If they're not supplying you with this, we can possibly help you at Titan Medical Center. So if you're getting your testosterone from your doctor and you're missing the other components as far as your estrogen blocker or your HCG or possibly one of our weight loss therapies or stuff like that, we can treat you just for that and help you out just for that. So just be in tune to that and be aware of it so we can help you out. If there's any questions or concerns, please DM us. Check the newsletter out. There's some cool polls in there. All the information about our events, everything that's coming up, Therapy of the Week, and a lot more, guys. So, I'm John from Titan. I appreciate you guys tuning in. Thank you guys for all the support. I really appreciate it. And be ready, because Titan is bringing some new stuff. I promise you soon. And you know I don't lie, so it's coming for you guys, all right? I'll talk to you guys later. Have a great week.